Discussions about having Kenya stop over-reliance on donor funds to run HIV/AIDS programs in the country and start thinking of ways of funding the programs domestically are ongoing. The head of the Directorate of Family Health in the Health Ministry, Bashir Issak, said the discussions along those lines, especially with the change in structures of social health insurance, will go a long way in solving existing challenges. Our reporter Ann Buru with the details.
According to 2022 estimates, 1.377 million people are living with HIV/AIDS in Kenya, with about 68,000 being children aged between 0 to 14 years. Of the 1.377 million people living with HIV, 57% are in 10 counties, mostly in Western and Nyanza regions. During the HIV Service Delivery Integration Summit, which attracted over 500 participants in Mombasa, the head of the Directorate of Family Health in the Health Ministry, Bashir Issak, said there has been a significant improvement since 2000, when the mortality rate was high, to date, where about 1.4 million people are on antiretroviral drugs free of charge.
The country has achieved a lot of progress in reducing mortality, in reducing the number of infections, in reducing transmission of infection from mother to child. And all these are achievements we are celebrating today.
Issak reiterated that there are various discussions regarding funding the HIV/AIDS programs domestically, especially with the change in structures of social health insurance in the country.
And we have commitment with our partners, with timelines, to take over this as government and to fund this thing domestically. We have been doing it progressively, but there are timelines where the government will have to take up all these investments on themselves in terms of domestic funding. And this also helps us in charting the way for sustainability in terms of service delivery.
Patricia Acero, who has lived with HIV for close to 30 years, said access to the treatment today is much better than in 2000, when one would easily die of HIV/AIDS. She acknowledged that there are safer and minimal intake of the antiretroviral tablets compared to the past, and more improvements have been made with the introduction of injectables, which are very expensive and not easily accessible in Kenya yet.
Science has changed a lot of things, and now we even have safer medication that we can take one tablet a day that is containing 3 pills. Because initially we'd take a cocktail, every drug on its own, but now we can take one tablet that contains 3 pills. Injections have also come on board, although we still don't have access, but we know that there are injectables that one can take one injection for 6 months, so that you can be taking 2 injections per year. So those are still not affordable to us, but we know they're out there, they are available.
She, however, said the integration of HIV services is still a challenge in Kenya, where services are still parallel.
Sometimes you have a swelling, and yet maybe it's medicine, and you don't know. So if only you were being seen in one place by one clinician who would be able then to tackle everything that you have. But the most important thing is to have clinicians who are trained in the different component of the disease, who can be able to prescribe, who can also help you to monitor your condition, to monitor the side effects, to change if there's a change that is needed at any specific time.
From Mombasa County, I am Ann Buru.